Okay, humans, this is part two of cases involving spirits and magical stuff and weird things. And as I keep saying, please don't judge Chinese medicine by um, the weirdness of these things, but these are, more interesting than just a simple case. The patient got a wind attack and then they took Tong and then they were fine. Those are good cases, but these are more fun. So I keep going with them. Okay, so here's a case from Gujin Yi An, which is ancient and modern medical cases that are annotated by this person, Yu Chen Chuan, whatever his name is, Qing Dynasty book, another book full of case studies. And so Li Shizai, and on the next slide, we'll find out who he is. I think it's Li Zongzi. He treated a literati, a scholar named Zhu Wenjai, and this Mr. Zhu, his entire body felt like bugs were stinging it. His mouth and tongue were rotten and eroded. When he got up in the morning, he always saw two ghosts. He thought this was a bad omen, and he thought he was about to die because he was seeing these things and feeling these things. So Dr. Li diagnosed him. His twin pulse was suddenly large, then suddenly small. So he believed this was a ghost or an evil spirit. So this pulse, suddenly large, suddenly small, is a symptom of ghost possession. We'll see it in the next case as well. And whenever you read that in a case, that usually means that the diagnosis has to do with ghosts or something like that possessing the patient. Mm. He carefully observed that both of the guan pulses were wiry, slippery, and large. Dr. Li decided that the illness was from phlegm rheum. So, phlegm is thick, turbid fluids, and rheum is thin, turbid fluids, and so forth. So, even though he's, got some ghost thought coming on, he also has some phlegm thought going on because, you know, doctors really aren't equipped to treat ghosts for the most part, but they can treat phlegm, and phlegm is a yin substance, and ghosts really love yin substances. So there's a correlation between people who act like they're possessed by ghosts and phlegm, whether or not they're actual ghosts, but if you've got this kind of phlegm affecting the heart, then perhaps you'll be seeing ghosts. So anyway, Dr. Li gave 3 qian of this formula called Guntan Wan. So it's a pill called phlegm rolling pill. We'll see it in a minute. So even though the patient, had bowel movements and a small amount of something came out, a small amount of stuff came out, the disease was still unchanged. Um, okay. So, so this Li Shizai is also, yeah, Li Zongzi, who wrote some pretty important books, and you can see his dates. He was at the end of the Ming and the very beginning of the Qing dynasty. He lived 11 years into the Qing dynasty. This formula, Guntan Wan, has Da Huang in it. It has Huang Qin in it. It has Meng Shi in it, which whatever that is some kind of mineral thing, and Qianxiang, which is used as incense, but it's also used in medicine. This formula seems to come from a book in the 14th century. Okay. And as I said, the pulse is suddenly large, then suddenly small, suddenly long, then suddenly short. Those kinds of things is a sign of ghosts. So Li then gave the patient 2 qian of another formula because the original formula didn't really do the trick. Wei Dan. And again, I don't really know what's in it. There's probably more Da Huang in it and, so forth. It seems like the Chinese is kind of mixed up and not exactly on the right page, but whatever. Then the patient had more 10 bowel movements that included a lot of phlegmy stuff and water. And the pain all over his body decreased by half. In addition, the ghost didn't show up the next morning. So then Li boiled 3 qian of ginseng and 2 qian of baiju into a decoction because he just made this person have so many bowel movements. He's probably exhausted. He's lost a lot of qi and fluids. And so now it's time to supplement. The patient took 3 qian of this same formula from before. He had 10 more bouts of diarrhea, about 20 bowls of it, but he like had a little bit of strengthening in between. Now his disease was totally gone. And so then after that, he used Lu Tang as made into pills. And after taking a whole bunch of it over a long period of time, he completely recovered from all his symptoms. So here, this Xiao Dan is got things that we are not using today. Yuanhua is one of those things that make you have violent diarrhea. So there's some instructions. This is, the old instructions how to make it. Gansui is another one that induces really violent diarrhea. Daji also, and Dahuang. So this is a really drastic formula just to give incredibly, strong diarrhea. Huang Bai. So this comes from Judanshi, this formula. Yeah, that'll get whatever's hurting you outside of your body. Here's another case also from the same book. And it's under the heading of ghost infixation. So somebody named Luo Qianfu, who's also known by the name of Luo Tianyi, he treated a government official named Shu. And government officials are really hard because it'll give the job title, but the job title doesn't necessarily make sense even if you know the various words in it. And I have a dictionary by Hucker of like Chinese job titles, official government job titles, but it didn't have this one, but it seems to be related to, you know, mail coming from overseas or wherever. So that's not important. His job title is not important. Anyway, so this government official arrived at some place and, wherever Luo was living, and he visited Dr. Luo to get diagnosed, to get treated. So Luo read his pulse, and it was suddenly large and then suddenly small, suddenly long and then suddenly short. This is that thing that indicates ghosts. There was an imbalance of qi and blood. Evil qi had damaged right qi. The official said, "Well, I was on the road. I arrived at a postal station. Government officials, when they were traveling, could stay at these postal stations, which are not exactly like our post office, but, somebody would have to ride a horse to deliver mail from one place to another place. And they had postal stations along the way where the postal people could stay, but also traveling government officials could stay there. And so he arrived at this, outpost and that night he dreamed of a woman who was wearing green clothes. I could not see her face or eyes. And then she struck me with her fist. She hit me below my rib sides. Then I had a bit of pain that comes and goes incessantly. And besides that, I have fever and chills and cannot eat." So Dr. Luo says this was ghost strike. Ghost strike is a condition where somebody has symptoms as if they were beaten up, but it never happened in real life. It may have happened in their dreams. It may have, a ghost may have did it, but they show up with like bruises and pains and all kinds of stuff that there was no fight. They just, that's a ghost strike. So yeah, this Luo Qianfu is Luo Qianyi, who was a Yuan dynasty doctor that was a disciple of Li Dongyuan. And as I told you, this is a ghost pulse. So Wo said, you can take a formula that's called Badu Chirwan, 8 toxins red pill. The official said he had read about it in some book, and this formula was apparently written by somebody named Li, who, it was a formula against ghost canings. So caning was a punishment back then, an official government punishment if you broke the law, and your punishment might be to get caned, which is taking a rod and beating the person's beat. there was like a smaller cane and a larger cane, and then they would so you might get sentenced to the small cane or the large cane, and then you might be sentenced to 10 blows or 50 blows or 100 blows. And sometimes people actually died after caning because it could be so brutal. And yeah, anyway. So ghost canings are like ghost strike, except it looks more like they've been caned. And so this formula was written for ghost canings. He then took 3 grains of the medicine at bedtime. Again, I've talked about this in another one. When it says a grain of medicine rather than a pill, that means it's something that's got heavy metals in it and minerals and stuff like that. And they're really tiny, tiny little pills, but like have a lot of toxicity in them. So he took 3 grains of the medicine at bedtime. The next morning, again, he defecated a whole bunch of clear water, and the treatment was immediately effective. So, this Li, who wrote this formula for ghost canings, was, you can see the dates of his time period. We don't know the exact dates of this person. If you want to know what's in this formula, we'll see it after the next case. It's listed after the next case. So this same doctor, Dr. Luo, the disciple of Li Dongyuan, he also treated the son of some important person. The son had taken a nap in the temple of the water immortal. So it sounds like this isn't a child. It sounds like this is, an adult son to be out wandering around. I don't really know, but that's, this is not a young child who just happened to wander off. Anyway, when he was taking a nap in the temple, he dreamed he had received a flat cake and ate it. Okay, so there's this character in Chinese, Bing, which is a flat cake. It could be like naan, like flatbread. It could be like those scallion pancakes. It could be even a very small thing, but sometimes it's translated as cake, but this is really a flat cake, pancake, that kind of thing. So we don't know what was in the flat cake, but when he was asleep in the temple, he dreamed that somebody gave him a flat cake and he ate it. And then he worried that this was some kind of weird thing that he ate that had some like spiritual powers, but probably bad spiritual powers. So he worried about it. His heart region and his abdomen developed glomus, fullness, and his food intake decreased. So glomus is a sensation that there's something there. Like maybe if you have to belch, but you can't, and you feel this, like there's this something inside you that is causing discomfort. But a glomus lump actually has substance. So glomus, the word by itself, is insubstantial. You can't feel it on palpation, but the patient feels like there's something there. It's an accumulation of qi. Glomus fullness sounds a little bit more substantial. So, he feels something building up inside of him, and he lost his appetite, his food intake decreased. And over the course of a year, he became emaciated and he suffered abdominal distension as if he had goo. So, goo is this ancient Chinese black magic thing that people were afraid of, but may never even have existed. But it also is a homophone. It sounds the same as another word, gu, which means like it's usually gujang, drum distension, which is kind of like the abdomen is big and swollen and hard. And so this sounds like it doesn't really mean gu, the creepy black magic. It probably means, he had something that resembled drum distension. So he frequently changed doctors and changed medicine, and he used shamans and he used prayers, but nothing was effective. He couldn't get comfortable lying down in his bed. So Luo diagnosed him and asked the patient for the whole story from beginning to end. And so he knows there's this like, metaphysical aspect to it, because he ate something in his dream in a temple. If you go to a temple, don't sleep in the temple. Don't mess with the statues in the temple. We've seen all these stories about this. Anyway, so Wo thought about it. And since the disease was not external contraction and it was not internal damage due to improper actual food that he ate. So how could he treat it? If he couldn't treat it as food, he couldn't treat it as exterior evils. He couldn't really treat it as emotions, maybe, at least not in the usual way. So he thought of this formula that we saw before from Li Ziyu, who, wrote this formula called Badu Churst One, the 8 toxins red pill. He thought that, again, that was the formula for ghost canings. He thought that would probably work. So Wo then gave the patient 5 or 7. They're saying pills. Um, so the patient took it and he defecated more than a dole. How much is a dole? I don't know, but he defecated a whole bunch of greenish yellow fluids. Again, these are like turbid fluids that are associated with ghost-like problems. Qi became regulated little by little. In other words, there are no more glomus because Qi is moving freely, his appetite's picking up, everything is a little bit more normal. And then Wo used other herbs to rectify Qi, and the patient recovered in several months. This medicine has miraculous effects. During treatment, one must cultivate themselves with fasting, bathing, cleaning the house, and calming the heart mind. And here's the ingredients of that formula, which we're not going to use today. Xianghuang, which is realgar, a mineral that has, I forget, is it arsenic or something like that in it? Fanshi is some kind of thing, another mineral thing, Jusha, cinnabar, blast fried fudza. Lilu is one of the things that make you violently have a bowel movement. Mudan Pi to regulate blood, I guess, and Bado, which is another one to make you have violent bowel movements. And then also one piece of Wukong, which is like the scorpion, right? Or is it the centipede, whatever. It's like you can see, I don't want to be taking this formula. Powder these 8 ingredients. Remember, the formula was called 8 toxin, because they're 8 toxic ingredients, and make honey pills the size of a soybean. Each dose is 5 or 7 pills, swallowed at any time with cold water. No, thank you. But we do have a better alternative on the final slide for this. This same passage goes on and says somebody was struck by a ghost. So there's ghost strike, they're like beaten up, they look beaten up, they feel beaten up, but it didn't happen in real life. So they call that ghost strike. His body was bruised and painful. He boiled Jinyanhua in water, took it and recovered. That's just honeysuckle. Nice. Okay. So the person who compiled this book, he wrote a note here. Up until this point, he's copying from other books, but now he has his own note. He says, a Buddhist monk named Shenro treated consumptive infixation, often using Jinyinhua vine. Okay, so consumptive is usually means tuberculosis. Tuberculosis patients would waste away and become emaciated. And so this may or may not be, Western medicine's tuberculosis, but it's some kind of consumptive disease where they become just emaciated and skinny and so forth. And again, they're using that word infixation, which it's not exactly like possession, but something has fixed itself in the person's body and is causing damage. Whether before we saw the term ghost infixation, here, something is infixing itself, causing, um, emaciation. Anyway, so, yeah, we can certainly use Jinyinhua, although the price has gone up quite a bit since COVID, but we can certainly use Jinyinhua, even if we can't use the 8 toxic red pill. So, this thing reporting that somebody was struck by a ghost and used Jinyinhua, he's saying must be based on this other report. Thus, using this formula is effective if somebody with corpse transmission consumption actually has a ghost thing leaning on them and implanted in them. So this literally says a ghost thing, a ghost substance. This is the same thing in Suwutang, 4 things, 4 substances decoction, a ghost thing. That's weird. This character, it literally can mean leaning on something. So the ghost is putting pressure on them, the ghost is influencing them and rooted in them and has rooted itself in them. As far as this corpse transmission consumption, this word is corpse, this word is transmission, and this word is consumption. And so that's, at some point they realized that, TB or, something that's probably TB was passed along from person to person within a family, but TB is not contagious overnight. It's like generally you have to be exposed for a pretty long period of time. So people in a family would one by one get tuberculosis and then become more and more emaciated and eventually die. And so they thought something from the corpse got transmitted because the family would wash the corpse and put it in a coffin and so forth. And the patient really looks like a corpse even before they die because they become so emaciated. So hopefully my explanations help make some of this make sense for you. Anyway, okay, that's my episode for the time being.